Good morning, everyone. So I'll be presenting a series of 3 cases of Purtscher's like retinopathy. The first case was a gentleman aged 18 years who had underwent hemicolectomy for carcinoma of the colon, and on the third post-op day he complained of decreased vision bilaterally. He was a hypometrope of 5 diopters. His visual acuity was 6/60, and otherwise the anterior segment was normal. The fundus showed patchy areas of retinal whitening, predominantly in the peripapillary region. OCT revealed inner retinal thickening corresponding to the region of the white patches and subretinal fluid in both eyes. We could not give intravenous steroids because of the risk of wound infection, since he had recently undergone hemicolectomy, and FFA also could not be done as he was quite debilitated. But with observation, his vision had improved to 6/18 in both eyes. Case 2 is of a 70-year-old gentleman who came with sudden onset of bilateral loss of vision along with headache, and he was a hypertensive on treatment since 2 years. His visual acuity was hand movements in both eyes. Otherwise, there was just senile immature cataract in both eyes. On fundus examination, there was extensive retinal whitening in both eyes over the posterior pole and peripapillary region, along with a cherry red spot-like appearance in both eyes. He also complained of headache, and on systemic examination, there were cord-like temporal arteries which were present. OCT of the both eyes showed inner retinal thickening bilaterally. So on systemic examination, his ESR was 55 and CRP also was raised, and FFA we could not do. MRI otherwise was normal, and because of the temporal cord-like arteries, a temporal artery biopsy was done, which showed features suggestive of temporal arteritis, giant cell arteritis. So we started him on methylprednisolone intravenous, followed by tapering dose of oral steroids. Although we started on steroids, after 1 month, his visual acuity had not improved much. It was just 1/60. The third case is of a 53-year-old lady who presented with gradual loss of vision in one eye. She was a known case of hypothyroidism. Otherwise, the ocular examination was normal. The OCT showed retinal thickening of the inner layer, but we lost her for follow-up. Her vision was 1/60 in the right eye. Left eye was 6/36, improving to 6/12. And we started her on oral steroids. This is the right eye photo, which shows patchy whitening, areas of retinal whitening in the right eye. Left eye looks grossly normal. And on 1 month follow-up, her vision had improved to 2/60 with oral steroids. So Purtscher's retinopathy is an occlusive microvasculopathy associated with trauma. It results from embolism or occlusion and other mechanisms like complement-mediated white blood cell aggregation. When it is because of non-traumatic causes, it is called as Purtscher's like retinopathy. Usually they're present with bilateral reduction of vision, and the fundus findings include cottonwool spots, intraretinal hemorrhages. Purtscher's flecken are, though considered to be pathognomonic, occur only in 50% of the cases. And the fundus changes usually resolve within a few weeks, but not all patients regain normal vision. Treatment of the underlying cause may not be always possible, and the outcome of treatment with corticosteroids do not have established role in the improvement of the vision. So this case series demonstrates the need for awareness of Purtscher's retinopathy and Purtscher's like retinopathy, and recognition of the pathognomonic features to arrive at the diagnosis.
Very well presented, Dr. GLADYS, and this shows how systemic evaluation of patients is very essential when you make ocular diagnosis. Picking up GCA is probably life-saving also for that patient, though vision didn't improve much.
Nice case. I think we discussed many things from your slide in the previous case, back-to-back Purtscher retinopathy. Thank you.